Research shows that a significant number of women have faked orgasms at some point, often just to protect their partner's feelings. That's not a reflection of your worth. It's a signal that most men don't fully understand female anatomy and physiology. I'm Dr. Nerita, urologist with 12 years of experience in men's health. Today, I'm going to share a science-backed 6-step approach that helps you give her deeper, more consistent pleasure, while also improving your own sexual health. Before we dive in, like this video, comment where you're watching from, and subscribe so you don't miss these evidence-based tips to improve intimacy, stamina, and confidence. Let's bust the first myth right now. Penetration alone is rarely enough for her to reach orgasm. In fact, studies show fewer than 25% of women orgasm from penetration alone, yet many men still believe that's the main goal. Here's the truth. Female pleasure is built on a sequence of stimulation: mental, emotional, and physical. Timing, touch, and attention matter more than you realize. Over my 12 years working with men, I've noticed a pattern. Men often know the technique, but miss the sequence and emotional connection. Women's bodies respond best when arousal builds gradually, starting with mental and emotional stimulation, then moving to clitoral, full body, and deeper internal stimulation. Men who master this approach not only increase her satisfaction, but also improve their own confidence and stamina. By the end of this video, you'll know the exact 6-step physiological sequence that can lead to more pleasure for her and more confidence for you. Step 1, mental and emotional connection. Biology. The parasympathetic nervous system governs relaxation and arousal. Emotional intimacy, through conversation, eye contact, or gentle touch, primes her nervous system for physical pleasure. Emotionally, feeling safe and emotionally connected reduces anxiety, making every touch more effective. Practically, start your encounter by checking in, holding her, or engaging in meaningful conversation. Don't rush. Let intimacy grow naturally. Retention tip: think of this as warming up her nervous system, just like stretching before exercise. Step 2, clitoral stimulation. Biology. The clitoris isn't just the visible tip. Internally, it's a network of erectile tissue with over 8,000 nerve endings, more than double that of the penis. Direct stimulation increases blood flow, engorging the clitoris and surrounding pelvic tissues. Emotionally, gentle attention to the clitoris builds trust, connection, and anticipation. Practically, start gently. As arousal grows, gradually increase pressure and intensity. Use fingers, oral stimulation, or vibratory devices, but remember, slow and deliberate beats, rushed and aggressive. This step is the gateway to her pleasure, and skipping it undermines everything else. Step 3, full body stimulation. Biology. Stimulating other erogenous zones, inner thighs, lower back, breasts, increases dopamine and oxytocin, enhancing arousal and emotional bonding. Emotionally, full body attention signals care and presence, enhancing intimacy and trust. Practically, use light touches, kisses, or massage. These subtle actions expand the sensory experience without rushing toward orgasm. Retention tip: think of it as layering pleasure, making each next step more intense. Step 4, G-spot stimulation. Biology. The G-spot, or Grafenberg spot, is a sensitive area on the anterior vaginal wall, 1 to 3 inches inside. When aroused, tissue swells and becomes more responsive. Firm, rhythmic pressure is ideal. Emotionally, timing is critical. Stimulating too early can feel uncomfortable or even irritating. Practically, only explore the G-spot after clitoral and emotional arousal. Use a come here motion with fingers, adjusting based on feedback. This deeper stimulation can produce powerful, full-body orgasms, but only if the sequence is respected. Step 5, penetration if desired. Biology. Penetration works best as the culmination of prior arousal. Alone, it rarely produces orgasm. Combining penetration with clitoral or G-spot stimulation enhances nerve engagement, blood flow, and muscle contraction. Emotionally, it signals shared satisfaction, not a performance metric. Practically, focus on rhythm, depth, and timing. Adjust based on her cues. Remember, blended stimulation is consistently more effective than penetration alone. Step 6, aftercare and emotional bonding. Biology. Post-orgasm, oxytocin remains elevated. Touch, holding, and gentle communication reinforce emotional safety and future arousal. Emotionally, aftercare enhances trust, intimacy, and connection, which contribute to overall sexual satisfaction. Practically cuddle, talk, or simply remain present. Avoid distractions. This step ensures the experience leaves her feeling valued and safe. Common mistakes men make. Assuming penetration alone is enough. Fewer than 25% of women orgasm this way. Skipping sequence and timing, stimulating the wrong area too soon can be neutral or uncomfortable. Failing to communicate, every woman is different. Observe, ask, and adjust. Neglecting emotional presence, distractions, anxiety, or mechanical behavior reduce intimacy. Over-focusing on technique instead of connection, sexual confidence grows from presence, health, and preparation, not ego. Follow the 6-step sequence: mental connection, clitoral stimulation, full body, G-spot, penetration, aftercare. Listen to her feedback: words, body tension, and breathing. Support your own performance. Blood flow, stamina, and erections improve when overall health is prioritized. Tip for older men: poor circulation, low stamina, or premature fatigue can hinder your ability to fully satisfy her, even with perfect technique. Solution: a natural, clinically formulated supplement rich in nitric oxide and other circulation-supporting compounds can improve erection quality, stamina, and performance safely without drugs or stimulants. Gentlemen, remember, sex isn't a test, it's connection. Size, technique, and duration are secondary to presence, patience, and emotional attunement. Even small, safe changes, like following the 6-step sequence and improving your circulation, can dramatically enhance confidence, intimacy, and shared satisfaction. Let's recap. Mental and emotional connection primes arousal. Clitoral stimulation is essential. Full body attention expands sensory pleasure. G-spot stimulation amplifies intensity. Penetration is the culmination, not the start. Aftercare reinforces bonding and trust. Mastering this sequence, combined with safe circulation and stamina support, will allow you to help your partner experience genuine orgasms while feeling confident and empowered yourself. Remember, age is not the end of vitality. Small, informed actions can bring comfort, freedom, and confidence, both for you and your partner. If you found this video helpful, like, comment where you're watching from, and subscribe.